And there's the anterior labrum, and it's detached. You see a little, like a little triangle with a light spot in the center. That's the labrum, and see, here's a posterior labrum, and that's fine. The anterior one, you can see that little triangle is detached. So we're gonna reattach it now arthroscopically. Look down here, sure enough, the MRI was spot on. There is the labral tear. So you can see I'm able to put my shaver in between the anterior labrum, which is the structure that gives the shoulder further stability. All right? Whereas here I can't. See, here it doesn't go in there. Hang in there. Right there. All right, let me get a good inferior view there. Right there. Oh, look at that. I needed one anchor because we got it just in the right place. So now you see when I pull on this, see it doesn't move. It'll heal anyway because I created some bleeding here. But here's the structural repair that brought the whole labrum, like what we call an anterior bumper. And he's going to be in a sling about 3 weeks. So, you know, but after like this, by the 4th week, he'll be like the other 2 fighters that we did recently, including the world bare knuckle champ. At 4 weeks, he was like this. So, you know, you can't stop these guys. No arthritis. I wish my shoulder looked like this. I'm also not 19, right? How old is this patient? 18. So I already cleaned up the undersurface, the rotator cuff, a little bit of fraying, and that's basically it.